Thank you very much, Tarren. Any questions? Representative D'Amelio?
Thank you, Mr. Chairman. And Tarren, thank you for your report. There's a lot of information in here, and I think it puts a lot in perspective. Just getting back to your study in Connecticut, according to your report, how are we doing, compared to other states, in this country?
I think it's very important to appreciate where you are, because you really do have a very competitive market. I've testified before the New York legislature on this similar issue, and when you look at and you talk about percentage increases, it's important to understand the base of the premium that you're talking about. The same is true when you're looking at medical loss ratios. So when you're looking at the premium levels, as I outlined in the table, and I pulled these right off eHealth last night, when you're talking about the percent that is going to the carrier that's not going directly to medical costs, that dollar amount is much smaller in Connecticut than it is in my own state of Maine, because our medical loss ratio might be at the same percent, but our premiums are so much higher that you actually have a lot more going to the carrier, and you don't have as much choice as you have available right here in Connecticut. So we actually talk about in Maine wanting to have a market more like yours that gives people more choice and availability, particularly for those people who tend to be the uninsured, who have least amount of access to employer-based coverage, who are the individual market. And what other states have seen, particularly in a recession, this is very true in New Jersey, is dramatic increases in their individual market take-up rates, because so many people are losing employer-sponsored coverage. It's the only place to go. And what sadly we're seeing in Maine is our individual market is shrinking, while nationally it's going up, because it's so unpriced competitive that it doesn't make sense for somebody to spend $152 a month for a plan with a $15,000 deductible that they might have a 1% chance of ever getting $1 of benefit from.
Thank you, sir. Any other questions? Yes.
I just have one more, Mr. Chairman, and thank you. When did this slide in Maine happen? You had a competitive market at one point. How many years ago, and what was the main factor, in your opinion, that caused it to slide?
Sure. We had a variety of reforms that were passed in the early 1990s with incorporating guaranteed issue and a modified community rating that creates very narrow rating bands in our individual market. However, we had a pretty flexible file and use premium approval process that since then, over the last several years, really since the start of the last decade now, has become much more stringent and much less based on the actuarial and underlying medical costs. We've also seen a dramatic shift in the last decade. We've had 120,000 people in Maine move from private coverage to Medicaid. And so one of the big underlying factors in our cost increase, we have the same number of people uninsured, but we've had this big shift to public payers that are paying 80 cents on the dollar. And so there's been a lot of pressure on the private market to make up for that difference, which is another big factor.
Thank you, Mr. Chairman. Before you talked about predictability, couldn't you still have predictability with a process like this? I mean, the process isn't trying to eliminate profitability. It's just, I guess, trying to stabilize it somewhat. Why would this process reduce the number of carriers in the state?
Well, I think it was surprising to me as well that when we saw this much more stringent file and approve process, I'm just mindful not to use the word politicized, a much more different file and approve process, that we did have carriers leaving the market. We had, just 5 years ago, we had more carriers in our individual market and in our small group market, and that's not because they've merged, that's because they are stopping at the Maine border and only selling in New Hampshire and Massachusetts. I think, though, one of the important things to consider is not just the predictability, which is a problem, but I care less about the predictability from the insurer standpoint and more about what options are available from the consumer standpoint. So if you're creating a process that takes so long to get a new product on the market, then that means that I, as a consumer, have very little choice. We are a small business. We have 6 covered lives in our own little think tank. And our small group carriers, it's such a long process for them to get a new plan that they only offer new plans every couple of years. So the plan that I'm in right now and that all of my employees are in, there's no other choice for me to go to. There's not even one with like $100 higher deductible. So I had to pass that entire premium increase along because the process was such that a new plan couldn't easily be offered.